Moving on, members, to file item 73, Senator Pavley. Oh, excuse me. On the last measure, amendments pending. Item 73, Senator Pavley. Pass on file. Item 74, Senator Hernandez. Pass on file. File item 75, Senator Liu. Secretary, please read.
Senate Bill 42 by Senator Liu, an act relating to post-secondary education.
Thank you, Mr. President. Members, SB 42 would create the California Commission on Higher Education Performance and Accountability as the successor agency to the California Post-Secondary Education Commission, CPEC. CPEC's funding was cut by the governor in 2011-12. SB 42 proposes a new and improved commission to steward a public agenda for post-secondary education performance and accountability. Californians must pursue an integrated higher education policy if we're to meet 21st century workforce needs and remain competitive in the world market. Our higher education segments must work in concert to achieve these goals. And the legislature, as well as the administration, should have a role in charting and tracking their progress. With state higher education coordinating body, we can effectively oversee the delivery of affordable, high-quality post-secondary education. SB 42 received unanimous support in the Education Committee, and I ask for your support on the bill.
Thank you, Senator Liu. Members, any debate or discussion? Seeing none, Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Bates. Aye. Bell. Aye. Berryhill. Aye. Block. Aye. Canella. Aye. De Leon. Fuller. Aye. Gaines.
Aye.
Aye. Galgiani. Aye. Glazer. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Wesso. Aye. Huff. Aye. Jackson. Aye. Lada. Leno. Leyva. Aye. Liu. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. Aye. Morrell. Aye. Wynn. Aye. Nielsen. No. Pan. Aye. Pavley. Roth. Aye. Runner. Stone. Aye. Vidak. Aye. Wachowski. Aye. Wolk. Wolk, aye.
Secretary, please call the absent members.
De Leon. Lada. Leno. Liu. Aye. Pavley. Aye. Runner.
Ayes 35, noes 0, measure passes. Noes 1, I'm sorry, excuse me. Measure passes. File item 76, Senator Hernandez. Secretary, please read.
Senate Bill 43 by Senator Hernandez, an act relating to health care coverage.
Thank you, Mr. President. Members, in 2012, the California legislature enacted legislation authored by myself and Senator Monning to establish in California essential health benefits under the Affordable Care Act. Earlier this year, the federal government issued new regulations requiring states to update their essential health benefits based on 2014 benchmark plans. The new regulations also create a definition of habilitative services, which is more generous than the California's current definition. This bill has been introduced to serve as a vehicle for the statutory changes necessary to conform to federal requirements. The actuarial firm Milliman has conducted a comparative analysis of California's benchmark options and concluded that benchmark options are all comprehensive, but that are some services that have differing coverage. This bill makes conforming changes to federal requirements, and we are also seeking stakeholder feedback on if we are to consider a different benchmark other than the Kaiser Small Group HMO 30 plan. I ask for your aye vote.
Thank you, Senator Hernandez. Members, any debate or discussion? Seeing none. Members, any objection to using our unanimous roll call? Seeing none. Yes. Ayes 33, noes 0, measure passes. Members, let's move to file item 77. Senator Hill, Secretary, please read.
Senate Bill 48 by Senator Hill, an act relating to the Public Utilities Commission.
Thank you, Mr. President, colleagues.
Senator Hill.
SB 48, along with SB 660 by Senators Leno and Hueso, is one of the Senate's two major Public Utilities Commission reform bills. This bill makes governance reforms, requires additional public outreach, and makes it harder for the PUC to ignore Public Records Acts and open meeting laws. Specifically, this bill makes PUC directors answer to the full commission instead of only to the president, subjects the executive director to annual performance review, subjects the PUC administrative law judges to the same ethical standards as those for other state agencies, requires the PUC to reach out to all affected parties, not just the utilities, before opening rulemakings, clarifies reporting requirements to the governor and legislature, and clarifies that violations of the Public Records Act and Bagley-Keene Open Meeting Act may be addressed in Superior Court, as is the case for California's other boards and commissions, and not appellate or Supreme Court, as the PUC maintains. This bill received unanimous bipartisan support in the Senate Energy Committee.
Thank you, Senator Hill. Members, any debate or discussion? Seeing none, Secretary, please call the roll.
Allen. I. Anderson. I. Bates. I. Bell. I. Berryhill. Block. I. Cannella. I. De Leon. Fuller. I. Gaines.
Aye.
I. Galgiani. Glazer. I. Hall. I. Hancock. I. Hernandez. I. Hertzberg. I. Hill. I. Hueso. Huff. I. Jackson. Lada. Leno. Leyva. I. Liu. I. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. I. Morrell. I. Wynn. I. Nielsen. Pan. I. Pavley. I. Roth. I. Runner. I. Stone. I. Vidak. I. Wachowski. I. Wolk. Wolk, aye.
Secretary, call the absent members.
Berryhill. De Leon. Galgiani. I. Hueso. I. Jackson. I. Lada. Leno. Nielsen.
Ayes 35, no 0. Measure passes. Senator Hill, for what purpose do you rise? Senator Hill says he has a second bill. Where's that on the? Senator Hill says he has a second bill. Yeah, Senator Hill, if we could go back to file item 60. Senator Block wanted to bring a measure forward, if we could, and then we could return. Secretary, please read.
Senate Bill 538 by Senator Block, and acroling to naturopathic doctors.
Thank you, Mr. President. Ladies and gentlemen, tens of thousands of Californians currently see naturopathic doctors as their primary care providers. California law should not unnecessarily limit the way that these providers can safely and effectively serve their patients. Given the tragic primary care shortage experienced by many in California, it's especially important that we not unreasonably limit scope. SB 538 removes barriers for patients seeking medical care from licensed naturopathic doctors by allowing them to prescribe medications such as insulin and antibiotics and perform minor procedures such as applying stitches and removing warts. Naturopathic doctors are already recognized by law as primary care providers who can independently diagnose and treat disease. SB 538 just expands their scope of practice so they can perform basic medical functions common in primary care. These providers are already educated and trained to perform these functions. Naturopathic doctors attend 4-year postgraduate accredited naturopathic medical schools recognized by the U.S. Department of Education. As part of their education, they complete a minimum of 1,500 hours in clinical rotations and a thorough curriculum in basic and clinical science that includes biochemistry, pharmacology, lab diagnosis, epidemiology, pathology, neuroscience, and clinical physical diagnosis. Now, these hours that they now complete are more than those required by Yale Medical School in these areas and slightly less than Johns Hopkins Medical School. Many other states have a broader scope of practice than even this bill would provide. In 9 other states, naturopathic doctors are currently performing exactly the same provisions of this bill with no problems. The National Practitioner Data Bank, maintained by the United States Department of Health and Human Services, has no record, and this is pretty amazing, has no record of any malpractice claim against any naturopathic doctor in the United States. Naturopathic doctors are licensed and regulated in California by the Naturopathic Medicine Committee, whose primary responsibility is to protect the public. The committee consists of 9 members, including 5 naturopathic doctors, 2 physicians, 1 who's a Harvard-trained MD, and 2 public members. In response to California's severe primary care shortage, the California Naturopathic Medicine Committee convened a subcommittee with an equal number of naturopathic doctors and medical doctors, and they recommended a scope even broader than the one outlined in SB 538. The scope additions proposed under SB 538 allow naturopathic doctors to prescribe Schedule 4 and 5 drugs and legend drugs without a supervision agreement with a medical doctor. Now, these are not the most major of the drugs. Those are Schedule 1 and 2 and 3. This is only Schedule 4 and 5 and legend drugs. Drugs like antibiotics, insulin, cough syrup with codeine, low-modal, Ambien. It also allows doctors under 538 to apply superficial stitches to remove benign lesions of less than 1 centimeter, that's very small, such as skin tags and warts that are not located on the face, to place barrier contraceptives, to provide intravenous delivery of medications, and to perform skin biopsies and then send the specimens to diagnostic labs. Now, it's important that these primary care doctors be allowed to perform these tasks, because if they can't perform them, they have to then refer their patients, who they see as primary care doctors, have to refer them to MDs. And those referrals, as we know, sometimes takes weeks, months. Oftentimes, the patient won't even bother to go if they're referred to another doctor. And if all they want is simple cough medicine with codeine or low-modal for diarrhea, by the time they get to the referral, the problem's over. If what they have is a skin tag that requires a biopsy, and they wait weeks or months or don't follow up, what starts out as a minor medical condition can become life-threatening. So this is an important bill. I also want to clarify what SB 538 does not do. SB 538 does not allow naturopathic doctors to perform surgery, does not allow them to use general anesthesia or treat cancer. These are not functions of primary care and are prohibited under current law. The changes in SB 538 will ensure that patients seeking primary care from a naturopathic doctor can receive the appropriate care without the additional time, cost, and health risk of finding another physician for these routine prescriptions and procedures. The bill is sponsored by the California Naturopathic Doctors Association, supported by the California Naturopathic Medicine Committee, Bastyr University, and AARP, the American Association of Retired Persons. I respectfully ask for your aye vote.
Thank you, Senator Block. Senator Stone?
Thank you, Mr. President and fellow colleagues. I want to applaud my senator, my friend from San Diego, in bringing this forward. In 2007 alone, U.S. adults spent almost $34 billion on out-of-pocket visits to complementary and alternative medicine providers. In my compounding pharmacy, which still exists today, I receive a lot of prescriptions from naturopathic doctors. They like to use natural products to treat hypothyroid, that's low thyroid hormone, hyperthyroid, large amounts of thyroid hormone in the blood, using bioidentical estrogens and progesterones for premenopausal and menopausal women, using natural testosterone, bioidentical testosterone for men that go through andropause. We hear about women that go through menopause. Well, men go through the equivalent. It's called andropause, and these naturopaths have a lot of extra training to allow for the prescription of these medications. Neuropathic medicine has emerged as a healthcare profession and is well suited to meet this demand. We see this revolutionary delivery of health care as we see the Affordable Health Care Act being unraveled. Many people are recovering or adapting to their healthcare physicians by adding more natural medicines, as I mentioned before, into their healthcare options. The academic requirements to be accepted require a 4-year degree, just like an allopathic or an osteopathic physician. They have similar undergraduate classes as allopathic and osteopathic schools, including extensive biology classes, general and organic chemistry and biochemistry, and psychology classes. The curriculum to become a doctor of naturopathic medicine is rigorous, but it's a little bit different than allopathic and osteopathic physicians of medicine by adding the following coursework of hydrotherapy, homeopathy, botanical and nutritional medicine. And during their course of study, they take 60 hours of traditional pharmacology, so they can be active prescribers of antihypertensive medications, insulins, and manage some of the more important disease states. They also have a 2-year internship residency program within the first 4 years of their class studies, where they take even more classroom pharmacology classes and practice their prescribing skills with the authority of their professors. One thing I like about naturopaths is that they have a very strong emphasis on disease prevention and optimizing wellness. Most allopathic and osteopathic physicians tend to want to specialize, which we've witnessed as a shortage of primary care physicians in this state, where 95% of the naturopaths actually go into primary care, which is something that is dramatically needed in our state. They can practice in private settings, hospitals and clinics, and in community health care centers. They can perform some minor surgeries, as my colleague alluded to, but cannot practice major surgery. They treat common ailments such as allergies, chronic pain, digestive issues, hormone replacement therapy, as I discussed, obesity, respiratory conditions, heart conditions, fertility problems, menopause and andropause, adrenal fatigue, cancer, fibromyalgia, chronic fatigue syndrome, and many, many more. I'd like you to know why I support this bill. These physicians, I believe, are well trained. I think they're underutilized. I interact with them when I was in full practice. My pharmacy still does. With their comprehensive education, they should not have to work under the auspices of an allopathic or osteopathic physician. They're already practicing in our state. We have a very good school in San Diego. It's unique in that they can prescribe traditional medications. Many use natural medicines, and some even further their education to be trained to give acupuncture. This bill lets them work freely, commensurate with their training and their education to promote good health and healthy treatment plans with defined limitations on what they can and what they can't do. Most services that they provide are private pay patients. Little, if any, Medicare or Medi-Cal programs are participatory in paying these professionals. And for these reasons, for hopefully getting more primary care physicians in our community health systems, I urge your aye vote.
Thank you, Senator Stone. Senator Hernandez?
Thank you, Mr. President, members. I too stand in support of the measure. If you look right now, 1/3 of the counties in the state of California now meet the national patient-to-doctor ratio of primary care doctors. Fewer and fewer allopathic trained physicians are going into primary care, more and more are going to specialty care. For one reason, for reimbursement rates, it's much higher, and you can't blame them. But we also have a distribution as well as a problem with primary care doctors going into rural and inner city communities. Is this going to solve the problem? No. This is going to help with the alleviation of primary care to allow them to expand their scope to be able to do more services. So there's a benchmark that I look at whenever there's a profession to allow them to increase their scope of practice. 3 things that need to occur. Number 1, does their education allow them? Number 2, is there an independent board or commission within the state of California that oversees the protection of the consumer? Because that's the absolute most important, is the protection of the consumer, members. And third, is it been done and at other states, but more importantly, is there a national standard that that profession upholds to in those other states? And in this particular profession, it meets all of those criteria. And I saw this bill when it first came out. It was much more extensive, but it's been scaled significantly back, and everything within it, they are capable and trained to do. And therefore, it'll allow this profession to be able to make an impact in primary care, and especially in those needs and those areas of greatest need. So with that, members, I respectfully ask for an aye vote.
Thank you, Senator Hernandez. Senator Mitchell.
Thank you very much, Mr. President. I have a question of the author.
Sure.
Yes.
Thank you. I listened to the comments of several of our colleagues that talks about expanding access, and I was confused by a comment made by Senator Stone that their services are covered under Medicaid and Medicare, Medi-Cal here in California, Medicaid. Could you, that's not what you said. Well, could you provide clarification on just coverage issues? Because as we're talking about expanding access, I really want to know, be clear about what population we're expanding access to.
Sure, thank you for the question. Two things. First of all, when not covered by insurance, naturopathic doctors charge far less than an MD. So there is more access than there normally would be to an MD, particularly for the same amount of time, because naturopathic doctors tend to spend half an hour to an hour with each patient, whereas MDs often don't, because they want to treat the whole patient, know everything that's going on with the patient. But with regard to insurance, in California right now, insurance does not cover naturopathic doctors. They don't cover naturopathic doctors now because naturopathic doctors don't have the scope that we're asking for in this bill. In the 8 states where naturopathic doctors do have the scope we're asking for in this bill, insurance companies have insured them. 2 of the states, Medicaid is covering local medical, state medical insurance. Aetna, Blue Cross, Blue Shield, Humana, all the big health insurance companies do in fact cover naturopathic doctors when they have the powers allowed in the scope of this bill. So insurance shouldn't be a problem for patients, and that will then expand access for patients to coverage.
Thank you. And one more point of clarification. We've received, you have opposition, as you well know, and there's a statement here that I'd like you to address. Unlike medical doctors, naturopaths have no required residency program. Could you address that, please?
Yeah, it is true. Right now, they do not have a residency program, but they do complete over 1,200 hours of clinical training. The difference, one large part of the difference is residency programs are almost always in hospitals, and naturopathic doctors are primary care physicians. So their training is not targeted toward hospitals. They do a more than sufficient number of hours of clinical training, only it's in the outpatient setting of clinics and their private offices.
Thank you.
Thank you.
Thank you, Senator Mitchell. Senator Pan.
Thank you, Mr. President, members. I unfortunately need to speak against this bill. Several statements have been made that I have to admit I'm a little concerned about. So first of all, I think in terms of training, I'm a past residency director for a medical residency training program. In fact, I used to serve on the Accreditation Council on Graduate Medical Education. It oversees all of residency education in the United States. And I think to so lightly dismiss the importance of residency training and the competence of physicians and the quality of care that all patients should receive, I think is a little concerning. Residency training in medicine is a very rigorous process, a minimum of 3 years, sometimes as long as 9 or more, where someone who spends 4 years in medical school comes out and they spend not just doing time, it's not just the number of hours, but also having to meet high standards in terms of having to pass exams and prove and demonstrate their clinical competence. And I think when we look at the quality of care we want patients to receive here in the state of California, I hope those are the type of standards we demand. In addition, not only do you have to pass an exam once every so many years, in fact, I have to recertify every 7 to 10 years to maintain my board certification. And that's a standard, again, that we're not seeing in many of these other scope expansions where people have to redemonstrate their competence over time as well. Now, this bill, of course, speaks to naturopathic doctors who have a very important place, certainly in our healthcare system, and we want to be sure that they have their place. But I do feel that this bill goes too far. I think that, for example, some regards to their ability to modify medications, just because you're Schedule 4 or 5 doesn't mean those medications are not significant. Any medication requires a prescription is significant. And I think that if you're someone's making modifications to their insulin, that's significant just because it's not a Schedule 1 drug. I mean, in fact, actually, the schedules are more related to their addictive potential than necessarily the seriousness of the medication, the condition you're treating. And so I would be very concerned about that. In addition, I would take some a disagreement with the statement that naturopathic doctors always spend more time with their patients than allopathic physicians or osteopathic physicians. I think that's depends on the circumstance and so forth. I don't think that's an accurate statement to say that they're going to be cheaper and spend more time with them. I think, in fact, I think there's many physicians who spend time with their patients and are committed to being sure they spend the time that's necessary to take care of them. Often I've had patients I've seen in my own clinic I've spent certainly more than half an hour with when they had complex issues. Sometimes even as much as an hour or an hour and a half if that's what's demanded to be sure they receive high quality care. So I certainly appreciate, and I think, certainly I appreciate the author's desire to try and improve access, and I think, and I attribute, I believe that you're trying to do what you think is best, but unfortunately, I just feel that this bill goes too far and is not something that I can support at this time. But thank you.
Thank you, Senator Pan. Senator Stone, followed by Senator Hill.
Thank you, Mr. President, for allowing me to speak a second and last time. I just want to say that when you graduate from an osteopathic school or an allopathic school of medicine, there's nothing that compels you to go do a residency. And those that do usually will do it because they want to specialize in a particular area, whether it's pediatrics, anesthesiology, dermatology. What we have in the state of California is a dramatic shortage of primary care doctors. And we have very few physicians that will take Medi-Cal under the present reimbursement schedules. And I just want to clarify for my good friend from Los Angeles, the senator from Los Angeles, that I wanted to make very clear that they do not participate in Medi-Cal. They do not participate in Medicare. However, by allowing this minor scope change that we're considering here today, it's my hope that they will participate in the Medi-Cal system and be the primary care physicians now that will accept the reimbursement levels that exist today so we can take care of some of our lower income people that deserve to be taken care of. I also want to mention again that they take 60 hours of pharmacology, and in the last 2 years of their 4-year educational protocols, they are still taking more pharmacology classes. I would call them advanced pharmacology classes, and they are practicing on patients. So they do come with great prescribing skills. And like I said, I've had a relationship with them in my existing pharmacy, and I can tell you that when the patients come in, one thing that they often mention is that this doctor spent an hour and a half with me on my first visit and just didn't talk about my hormone treatment, but discovered that I have these other issues. Another important factor is that if there is something that is a very serious issue, as an example, a naturopath may send out a sample of tissue that may look suspicious, and it comes back that it has cancer. It is not that naturopath now that is going to take care of a malignant melanoma situation, which can be life-threatening, as many of you know. He's going to refer that off urgently to a specialist, an oncologist, a dermatologist, to make sure that that patient that maybe otherwise didn't have the means to be seen was seen, and it was caught early, and it might save their lives. So anything that we can do in the state of California that can have more primary care physicians participating, especially in the Medi-Cal program in the future, is something that I hope that the Senate will embrace. Again, urging your aye vote.
Great. Thank you, Senator Stone. Senator Hill?
Thank you, Mr. Chair, Mr. President, and members. I rise in support of this bill. And as Chair of Business Professions and Economic Development, we had a very exhaustive discussion and conversation regarding the minor, and I think I need to emphasize the minor increase in scope of practice. When you look and read, if you look at the analysis at the minor procedures that would be included. I mean, local anesthetic solutions, adjuncts and dilutants, removal of clinically benign skin lesions. I mean, we are talking about minor, not major medical procedures that I think some of us may have in our minds that is what we're allowing in this legislation. The key and the major responsibility that we have, as Dr. Hernandez mentioned, is to protect the consumer. We're here to protect the consumer. And the committee looked at, under the lens of protecting the consumer, with the proficiency level that would be necessary and the knowledge level that would be necessary to provide these very minor procedures and the prescribing of those Schedule 4 and 5 drugs. And in doing that, the question was raised in a previous committee that well, there's no certification requirement now of these naturopathic doctors. They don't have to now take increased residency or increased courses, so there's something wrong with that, was the implication. But the reason they don't have to take any further certification is that they were trained already. When they went to school in that 4 years, they learned how to do these basic procedures that we're talking about. They knew the pharmacological requirements and scope that's necessary to do that. They're already trained in how to do this and provide these medical procedures, these very minor medical procedures. So it's very important in this day that we increase, especially for primary care physicians, those who feel that a naturopathic physician meets their medical needs for those areas that are important to them and those areas within the scope of practice for the naturopathic physician and doctor. So I support this legislation. I urge all of you to support it. This does increase the access that's so critical today around the state of California. I ask for your aye vote, members.
Great. Thank you, Senator Hill. Senator Pan?
The members, I do feel I must correct the statement that was made earlier. It was stated that residency is not required for allopathic physicians. That is not true. In order to get a license to be a physician or surgeon in the state of California, you're required to not only graduate medical school, but to complete at least 2 years of residency training. So I just wanted to be very clear about that factual point, that in order to become a licensed physician in the state of California, you must both graduate from a medical school, allopathic medical school or osteopathic school, and complete 2 years of residency training. Otherwise, you cannot be licensed to practice in the state of California. Thank you.
Thank you, Senator Pan. Well, debate and discussion having ceased, Senator Block, would you like to close?
Yes, first of all, I'd like to thank my colleagues for their supportive words about this bill. The bill had a thorough hearing in BNP, and the BNP committee quite clearly decided that this was a scope increase that was minor in terms of scope, but major in terms of the welfare of Californians who don't have access to primary care physicians in many regions of the state, from urban centers to rural areas. Right now, you may say you want a Harvard-trained neurosurgeon to be your primary care doc, but frankly, that person is overtrained. Right now, you don't have that comparison to make in many parts of California. In many parts of California, do you have a neuropathic doctor, a naturopathic doctor, or do you have no physician at all? No physician at all. Now, it's rare for members to talk about flyers being passed out by the opposition on this floor. But there's one here that's so blatantly false, I need to bring it to your attention. Many of you have gotten this and talked to me about what's in the flyer. It makes 3 arguments. Number 1, it says that you should vote against this bill because naturopathic doctors aren't covered by insurance. Well, we've already dealt with that. Senator Mitchell asked the question, and in fact, in 8 states, all 8 states where the scope that we're now requesting is allowed, naturopathic doctors are covered by insurance, so this will expand the scope. So argument number one is misleading. If not false, it's misleading. Argument number two, naturopaths would be allowed to perform surgical procedures without any additional training. The surgical procedures they're talking about here, I don't know about my colleagues, and I'm sure a physician maybe thinks of it differently, but for me, I think of surgery as being, heart transplant or removing a gallstone or something. I mean, the surgical procedures they're being allowed to perform here that are called surgical are removal of a wart, removal of a skin tag less than 1 centimeter in size and not on the face. So again, this may not be totally false, but seriously misleading. I wouldn't carry a bill that advocated people being allowed to perform surgery without training. The last of the three arguments, naturopaths will be allowed to prescribe dangerous medication without proper education and clinical training. First of all, the medications that this bill allows are only Schedule 4 and 5 and legend drugs, which are the least addictive and the least potentially harmful of all drugs. Schedule 1, 2, and 3, the ones about there would be concern, are not part of this bill at all. They are not part of this bill. And in terms of no training, in pharmacology, naturopaths have to do clinical science courses as well as clinical application through 1,200 hours of rotation. 1,200 hours of rotation. So to say there's no training in pharmacology is just blatantly false. Last thing I want to say, in Senator Hill's committee and in the BNP committee, we had 5 MDs who testified. 5 medical doctors, MDs who testified. Not 1, not 2, not 3, but 4, but all 5 of them testified in support of the bill. Not one, not a single MD in California or from any other state testified against the bill. The only testimony against the bill was by firms hired to lobby against the bill. Not one MD testified against the bill, 5 in support. And with that, I'd ask for your aye vote.
Thank you, Senator Block. Secretary, please call the roll.
Allen? Anderson? Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Cannella? No. De Leon? Aye. Fuller? Gaines? No. Galgiani? Aye. Glazer? Hall? Hancock? Aye. Hernandez? Aye. Hertzberg? Hill? Aye. Wesso? Huff? Jackson? Lada? Leno? Leyva? Aye. Liu? Aye. McGuire? Mendoza? Mitchell? Aye. Monning? Morlock? No. Morrell? Wynn? Nilsson? Pan? No. Pavley? Aye. Roth? Aye. Runner? Aye. Stone? Aye. Vidak? No. Wykowski? Wolk? Wesso, aye. Anderson, no.
Call the absent members.
Wynn, aye. Allen? Aye. Fuller? Glazer? Hall? Hertzberg? Huff? Jackson? Lada? Leno? McGuire? Mendoza? Monning? Morrell? Nilsson? Wykowski? Wolk?
Senator Block moves the call.